The most recent Medicare for All health plan from the Senator Bernie Sanders, Vermont independent would require tax increments as government replaces workers and customers pay for medical services. As per the investigation being released on Monday by the Mercatus Center at George Mason University in Virginia, it would convey huge reserve funds on organization and medication costs. However, expanded interest for care would drive up spending, the investigation found. As plans of Senator Bernie Sanders expands on Medicare, the insurance program for seniors, all U.S. citizens would be secured with no co-pays and deductibles for medical services. The protection business would be consigned to a minor part. Authorizing something like Medicare for All eventual a transformative change in the extent of the national government, said Charles Blaze. Previously, senior monetary guide to previous President George W. Bramble and an open trustee of Social Security and Medicare amid the Obama organization. In the event that each real nation on earth can ensure social insurance to all, accomplish better health results, while spending considerably less per capita than we do, it is ridiculous for anybody to propose that the United States can't do likewise, Sanders said in an announcement. This terribly deceptive and one-sided report is the Koch siblings' reaction to the developing help in our nation for a Medicare for All program. Senator Bernie Sanders' office has not completed a cost investigation, a representative said. Sanders' staff discovered a mistake in an underlying variant of the Mercatus report, which counted a long-term care program that was in the 2016 proposition yet not the present one. Blaze amended it, decreasing the estimate by $3 trillion more than 10 years. Blaze says the report is his own particular work, not the Koch siblings. Likewise called single-payer throughout the years, Medicare for All mirrors a long-term wish among liberals for an administration-run system that covers all Americans. The thought won expansive general population support after Sanders kept running on it in the 2016 Democratic presidential primaries. Looking forward to the 2020 decision, Democrats are debating whether single-payer ought to be a litmus test for national candidates. More than 10 years that ran from $24.7 trillion to $34.7 trillion. The investigation of Mercatus assessed the 10-year cost of Medicare for All from 2022 to 2031, after an underlying stage in. Its discoveries are like those of a few autonomous investigations of Sanders' 2016 arrangement. Those examinations discovered increments in government putting in more than 10 years that ran from $24.7 trillion to $34.7 trillion. Mercatus study disagrees with a key cost-bearing element of the plan that doctors' facilities specialists will acknowledge installment in view of lower Medicare rates for every one of their patients. The investigation found that the arrangement would harvest considerable reserve funds from bring-down solution costs $846 billion more than a long time since the legislature would bargain specifically with drug makers. Funds from streamlined organization would be much more noteworthy, about $1.6 trillion. In any case, different arrangements would tend to drive up spending, including scope for about 30 million uninsured individuals, no deductibles and co-pays. Enhanced advantages, including dental, vision and hearing. However, subsequent to considering current government medicinal services financing, the examination evaluated that multiplying all elected individual and corporate pay duties would not completely take care of the extra expenses.